is not very good. So I asked, okay, which type of lens was implanted? And what I was expecting, he said the same answer, that he has had a multifocal lens implanted in both the eyes. Now, decreased contrast, slightly more glare is a normal feature with this lens. However, the shifting of the vision from far to near to far is probably that your muscles are not yet tuned. You need to do some eye exercises to train your muscles now. So with that you can improve more. He was also talking about some mucus discharge, some dryness. So dryness also happens with age. So use of lubricant eye drops, eye exercises will actually further help you in your vision. However, it being a multifocal lens, the advantage is, yes, the glasses are not needed, you are practically free of glasses, but the disadvantage is there is some glare and some decrease in the contrast. So this is what you have to decide beforehand, that according to your lifestyle, whether you really need that sharp contrast and night vision, or you cannot, you can do very well without it, and you would rather have the advantage of being glasses free. Or if somebody whose requirement is that they need very sharp vision, no glare, a lot of nighttime driving, for them I would advise going for unifocal lens and be content with the use of reading glasses. You cannot get everything. What God made, that was perfect. What man made can never be perfect. We can try to imitate God, we can try to be so close to that, but we can never replicate them. And often patients, what the thing is, look, we are spending so much money. You're charging us 1 lakh, 1.5 lakh for this surgery. Why do you have to wear glasses? I say, look, we are trying to imitate nature, we are trying to go close to it, but we cannot replace it. So it's best to know these things beforehand and have very realistic expectations from the surgery, from the results, and be prepared to accept the shortcomings of this. Right. See, after all, cataract also happens in the natural eye. If the human body was so perfect, we would never age. We would live forever. We will have sharp vision forever. But it doesn't happen. It is nature's rule that things need to degenerate. The things need to go down, and we have to willingly accept that decline in our lives. So why not accept shortcomings in the surgery also? So it's a humble request to everybody that don't expect the doctors to be gods. No? Yes, expect them to pay full attention to you, be committed to you, do their best. But yes, just accept when they do their best. Their best can never be even half as good what God can be. Is the surgery painful? No. The surgery is not painful at all. It is done under eye drop anesthesia. We don't even give any injections anymore. Patient does feel some stretching on the eyes when the eyes are open. You do feel some pressure on the eye. There is no pain felt in the surgery. All that you do is lie down straight with the arms by your side, look over at a bright light of the microscope. But yes,
in one eye, when I was operated upon, there was no pain at all. In the other eye, there was pain.
Second eye,
during the
operation. In the second eye, there is pain.
To the extent that doctor said, well, don't stop going ooh and ah, I'm going to stop the surgery.
It is second eye which was painful, sir. Was it? Yeah. Okay. So I'll tell you why does it happen. Yes, sir.
I as a patient, when I grow old, I get all these things. When I young age, these things don't happen.
Yes, sir.
Okay. So there is no harm using specs.
Yeah.
But what I need at this point of time is the best I can do it, the best I can get it done. Glasses doesn't matter. Even today, I'm wearing glasses and a lot of people wear glasses also. For me, who will decide? Doctor will decide which is the best thing for me to do it. Like you said, the first thing I don't remember the name. That is the best one for the multi. Because I need the sharpest, the best as I grow old. I need all these things.
So that's why I said that you have to actually collaborate with the doctor. You and the doctor have to become partners in your treatment.
I don't understand these things. Doctor has to tell me what to do.
That's why I said that you have to tell the doctor your requirements.
My requirement is to get the best.
No. This is what where we actually tend to go wrong. You have to tell what exactly you need. What is your lifestyle? How do you spend your daytime? How much of driving do you do at night time? Whether you play any sport, when you play any golf, or you go to the club and play bridge. How much of outdoor person are you? How much of indoor person are you? How much of reading is involved in your thing? So what is your visual requirement? You have to make the doctor understand. And then tell the doctor, okay, fine, I'm not concerned about wearing lenses and not wearing glasses. My requirement is this. Which do you think is the best way? Then doctor will explain to you, okay, fine, this is the advantage of this lens, this is the disadvantage of this lens. And if you think that you're in agreement with what he is saying, opt for that. That's what I said, the best, the word best is actually very, very wrongly used. What is best for you may be the worst for me.
Understood.
Right. So, and we should not, do not equate the price of the lens with the quality of the lens. The most expensive lens may not be the best lens. Maybe a very humble lens may be the most suitable. So, because if you equate the price, then you will go for the multifocal toric lens, which is the most expensive. And you may find that no, it is got there, the contrast is not so good. So,
Sanjay, can I interrupt you?
yeah, sure.
So you answered your question yourself when you said you don't mind wearing glasses. So the sharpest vision is with the unifocal lens, as Dr. Sanjay said. The sharpest to the least halos and glares is the unifocal lens. So probably that would be best suited.
So the lens
Without
will-
getting confused.
specs will be both for reading and
Mainly for one, the other one would be a minor difference.
it has to be bifocal.
Maybe bifocal or that will depend post surgery because as we said, we are not 100%. For 2% you might need glasses, but you have dependence for one and treatment for the other.
There may be mild pain for 2 to 4 hours after surgery, for which some painkillers are given, and the pain is gone by the next one. So it's a fairly comfortable convenient surgery. It's done on a daycare basis. So you need to spend about 3-4 hours in the hospital only, not more than that. There's some time required before the surgery for dilating and preparing the eye, some time for recovery afterwards. So typically about 3 to 5 hours is all that it takes. It is important to not rush into the hospital and try to rush out of the hospital. Often patients they come and say, oh, when will discharge, not realizing when you go home also you have to just relax. So be prepared to spend about 3 to 5 hours in the hospital. Most people can resume their normal activities from the next day. Even on the same day also people can go home, walk around, look after themselves, So there's no care required. So you're up and about, you can move around, you can take care of your own self. You can even watch TV on the same day. But yes, I would, on that same day of surgery, you need to take things a little easy. The next day, you can start going out. You can start most of your normal stuff from the next day. There's some precautions are there, like no massaging, no pressing the eyes for a month's time. Water should not go into the eye for a month's time, but you can have a bath in the next day. The visual recovery is quite good within a few days to a week's time. However, it continues to improve over the next few weeks. At about 3 weeks, 2 to 3 weeks or 4 weeks, we give the final glasses to power to the patient. We check for the glasses number, and whatever number is there, we give the number after 2 to 4 weeks time. There are medicines required, about 2-3 medicines for 1 week and 1 medicine for another 2-3 weeks time. So the precautions are only minor and it's only for a month's time. In a week's time, you practically, back to your normal. For first week, there will be a bit of irritation, a bit of discomfort, but not really much. Most patients, become quite okay within a day's time, but that part varies from person to person and depending on how your body behaves, how your eye behaves, how complicated the cataract was.
Sorry, sir. Can I just say?
Yes.
I had a multifocal operation. The same day, after 2 hours, distance was going to be short. But the reading took 3 months to really get back to sort of normal.
Let me answer this question.
So as we said, multifocals have their shortcomings. When was your second eye done?
No, about a week later. Took 3-4 days.
That's when the adjustment starts. In multifocal lenses, what we say is the brain has to adjust to this new kind of lens. It's not used to those.
Yeah. Please use
It's an adaptation. Sorry. It's an adaptation of the brain. We call it neuroadaptation. So that is why it takes about 3 months. So it depends how fast the patient
आवाज
मोबाइल नहीं नो नॉट
Yes.
Can you hear me? So it's a neuroadaptation. That's why we ask questions to the patients that how fast did you get adjusted to your multifocal glasses? So many times people have tried multifocal and bifocal glasses and they had to throw them away. So we say you're not suited for multifocal lenses. So everybody does not have that ability of rapid neuroadaptation. And it can vary from individual to individual and upon the nature of the vision also. Some people are very fussy. We say don't get multifocal. So these are very similar.
The point is that, in multifocal lenses, the vision that you get is a total vision from whatever you have experienced so far. It's a totally new kind of vision which you have. Because the same lens, at the same point of time, is focusing far and then near together. So suppose there are actually multiple things in your line of vision, all are focused together. And that can be a little unnerving and distracting somewhat. So you have to train yourself, even that training happens unconsciously, to ignore the image that you are not interested in. Suppose you get far off thing, but the near image also interfering with your vision. You have to learn to ignore that. The brain automatically learns to dim it down or switch it off when you get far off things. But when you're focusing at the near object, the brain also learns to dim down or defocus or ignore the far. So this adjustment is what is called the neuro adaptation, and that takes a few weeks to a few months time, once after both the eyes are done. So this is a new type of vision. It is not similar to the multifocal glasses. In multifocal glasses, even progressive or bifocal, when you're looking down, only the near is focused. The far is not focused. Yes, there's a distortion seen on the side that will get used much earlier on. But only the one thing is focused at a time. Whereas in this one, two distances are simultaneously focused on it. So that is a new type of vision. That's the reason why it takes a little time to get used to that. And one should, with a peaceful mind, with an accepting mind, wait for the 2-3 months time to get used to that.
What is the risk factor in this?
Risk factor. The risks are there can be risks of things going wrong during the surgery. There are risks of things going wrong after the surgery. During the surgery, there can be very, things that we scared of is support for the artificial lens may get damaged. So if we do not have enough support for the lens that we want to implant, we may have to go for an alternate type of lens. Which may not be, as the visual quality may not be as good as that of the lens that we want to do. And that will make surgery more difficult. We may have to do some extra steps to create support for the lens. And sometimes the lens fragments may fly off and go into get themselves lost in place, which is difficult to reach. So we may have to do a different surgery from different route to retrieve them. These are things which can go wrong during the surgery. I'm talking about the important risk factors, not about the minor ones, the major ones. After the surgery, the major risk factor is of infection. Though the occurrence of infection is only about 0.01 to 0.03% all over the world. And but yes, if it occurs in one patient, for him it is 100%. Because once the infection gets into the eye, then managing it becomes very difficult. Why? Because the drugs, whether taken orally, whether taken into the vein or into the as drops in the eye, they do not penetrate the eye deeply. Because the eye is a very hard shell. It is secluded from the rest of the body circulation in a big way. So there is a barrier between the blood circulation and the eye. So the barrier, the drugs cannot cross that barrier. So the drugs don't reach into the depth of the eye. And that's what makes the management of infection is a little more tricky and difficult. Infection does get managed, however it will leave behind scarring, and that affects the vision. So these are the most important, most risky big problems that we can have. I'm joined by another colleague, my Parul. She's the water effect from Gurgaon, breaking the rain.
It's a one-time shot only, this operation.
This is the one time.
The reason I'm asking you is, I know a friend of mine who got operated. One side vision is almost like half of the other. So he said this side is really good. So that is why I asked you, what is the success percentage in this sense?
The success in terms of vision as a surgery is one of the most commonly done procedures, one of the most advanced and controlled procedures, and it is one of the most successful procedures across medical science all over the world. So I would say, I think I may be right in saying that cataract surgery is the commonest surgery performed all over the world for the longest of time. And fortunately, cataract surgery was first performed in India by Sushruta. So we can proudly say that India was the first one to perform cataract surgery. And so from those ages, it's evolving over a period of time. Because one of the safest surgeries, one of the most successful surgeries, the results are as high as, as close to 100% as possible. So maybe only 0.some% of cases, the results which is not successful, but otherwise it is very successful. It's a very safe and accurate surgery. And surprisingly very economical surgery also, compared to other surgeries that are done for, say, bones or heart or anything else.
Because you hear in newspaper, no, they did some surgery for 100 feet, 50 feet, and this thing. That means
Okay, see, of course, the way you drive a car will define the safety of your vehicle also. So if somebody drives rash on the road, where one's supposed to drive very safely, so, in present day times, I'm not in favor of those kind of camps. Camps are not really required. Now that with the facilities being advanced, hospitals being available everywhere, doing camps in the periphery in large scale is not really desirable. And when there is a cost cutting involved, cost cutting happens only in the form of these agencies who do camps, or the government agencies which hold camps, or charity agencies. They have limited funds. They have limited funds, they have limited resources. But the output, they don't want to limit the output. They still want to do high numbers, high volume surgery because they want to get more funding from other. It is when you're pushing the quantity over the quality that things go. So if a surgeon should ideally not perform too many surgeries in one day. After all, you're a human being, you should get tired also. So this is a limit. So if I say in one set of equipment, one set of people in one location, if you do large volume, especially in a new place which is not geared for anything, things are likely to go wrong. And then it's not just the eye surgery, other surgery have gone wrong also, with media reports also. As a result of which, now the surgeries, peripheral surgeries, in the camp have been completely banned for the last almost 10-20 years. So the surgery have been performed in a hospital only. Though still there's no limit on the number of surgeries that should be performed in a day for a given resource. So I think the government may soon, develop some guidelines where the number of surgeries that can be performed in one day, in one OT, with a given set of people will also be limited.
Also, mostly, I think the fluid is at fault. These surgeries which go massively wrong, there is some cost cutting in the fluid which we use, and that's mostly responsible for the large number of loss of eyes, which is like introducing infection into the eye.
Actually, that is what happens most of the time. I didn't want to say that, because that will make blame on a particular thing. Many times, the infection is not that something is introduced by a surgeon. So it